I am Jim Fitzgerald, a Lean Six Sigma Master Black Belt and Innovation Master. I am discussing Lean Six Sigma for hospitals and the Toyota production system. For those that are not very familiar with the Toyota production system, I think Toyota did this on purpose. They call it a production system when it is really a business system. This Toyota system pervades the company. This is how a hospital should run, as a system delivering care to patients. Let's look at what a patient-centered hospital can do. The Lean hospital focuses on the patient. This can be demonstrated in three ways. If you have an emergency department that processes sick and injured patients through in 2 to 4 hours, you should be ashamed of yourself. These are your customers. There are competing hospitals out there that average 38 minutes from patient walking in to walking out. Think how that would decrease costs and increase patient satisfaction. Waiting rooms are an indicator of disdain for patients. A good metric for patient disdain is the number of patients waiting in the waiting room. How about if a patient walks in and they go directly to the back? Go to the hospital to get better, not sicker. HAIs are the bane of hospital patients. It's time for hospitals to stop making patients sick. Some lean hospitals have 0 HAIs for years. Quit harming your patients. Hospitals have challenges and exist in a complex world. Hospital challenges. How often do you rid your patients of germs instead of infecting them with germs? If you have a patient that gets infected with an HAI, then you have a defect in your process. Cost controls come from external forces like Obamacare and internal forces like the requirement that you operate with a profit. Competing hospitals that are running lean are taking your customers. Lean Six Sigma operates as a paradox. As you remove operations that do not add value for your patients, they go through the system faster, less errors are made, costs go down due to less work. Hospitals increase their profit margins, satisfy patients, and make less mistakes. It's a win-win-win world. The environment the hospital is working in is changing and will continue to change. Controls increase and what an insurer will pay is changing. Will an insurer pay for a mistake or a poor outcome? Medical equipment is expensive. That is just the way it is, and there are good reasons for it. As the population gets older and older, there are more and more patients. Patients are a load on the hospital system. Is the hospital customer the insurance company who pays the bills or the patient that reviews the hospital? In reality, it's both. But you will find that if you become a patient-focused hospital, both customers will be pleased. What happens if you don't change? Lean hospitals are gaining market share from non-lean hospitals. Lean hospitals are increasing occupancy. Lean hospitals are decreasing costs. Lean hospitals have a much better chance of increasing margins. Let's look at a non-lean emergency room. Patients are your customers, just like customers at a restaurant or department store. Do any of these people look happy to be in your hospital? Would you be happy? For a new experience, look at your hospital from your customer or patient's point of view. How do lean hospitals operate? These statistics say it all. Increased market share, improved patient outcome, decreased cost, increased patient interaction, better employee satisfaction, and the list goes on. Let's look at a couple more examples. Memorial Hermann Health Systems is no longer infecting their patients with pathogens. If you are efficient, do you need a waiting room? Maybe not. If 90% of liability claims had someone on the healthcare team notice something wrong but did not stop the process, then something is wrong. The easy projects with low-hanging fruit are all gone. Improving will take a team effort. If your emergency department is slow, then that is a good place to start. It is visible to lots of people. The Patient Safety Alert Program is probably one of the most important programs to start. It protects your patients from harm and decreases the cost of insurance. It is time to bring excellence to hospitals, just like to Toyota. I am Jim Fitzgerald, a Lean Six Sigma Master Black Belt and Innovation Master. I look forward to guiding your journey into bringing the benefits of Lean Six Sigma to hospitals.